The American workforce looks much different than it did 10 or even 5 years ago, let alone 100 years ago when some of our labor and employment laws were first enacted. There are now more than 27 million Americans working as independent contractors, having the flexibility to make their own schedule to decide when, where, and how they want to work. More and more I'm hearing from people back home, and they want jobs that offer this type of freedom. Just one example I love to share. I got picked up by Uber or Lyft at the New Orleans airport, and the guy had just moved from San Francisco to New Orleans. Two great cities, but obviously he chose the best of the two, and he just wanted to do it. And so he calls up Lyft and says, I'm moving to New Orleans. He shows up and then goes immediately to work. Because he worked independently, he had that freedom to move place to place without losing a source of income. And then another guy, he's a daggum chemical engineer, and he says he'd rather be a Lyft driver. And he goes, I'm tired of the cubicle. He goes, I got this car. I take the car fishing on the day off. I can take my day off anytime I want to take a day off. But he stays with his chemical engineering job because he wants the benefits. But he'd rather have the freedom and the benefits. Now, I get that. People need a 401k, they need health insurance. So whether it's a hairstylist, musician, artist, in my state, a swamp tour guide, a rideshare driver, software designer, independent truck driver, none of them should have to choose between a flexible work schedule and having a 401k or health coverage. So Congress, we, should modernize labor laws to catch up on the 21st century and meet the needs of today's workers. Now, our labor laws are about 100 years old, and that prevents the independent worker from receiving the benefits that they would have if they choose to be a flexible independent worker. Now, we've heard from companies that want to give benefits to contractors, but they don't because of fear of misclassification lawsuits. So last week I joined Republican colleagues, Senators Paul and Scott, in releasing a legislative package modernizing federal law, giving power back to the workers. This pro-worker package establishes a safe harbor so that a worker can keep his or her independent status while unlocking benefits for themselves and their families. It strengthens workers' flexibility. It makes it clear what legally constitutes an independent contractor. The package also increases workers' access to health care and retirement accounts like solo 401ks that are already available under federal law. I appreciate Senator Paul and Tim Scott for their leadership. And by the way, this is not partisan. States with Democratic governors like Pennsylvania, Maryland, and Wisconsin, red states like Georgia, Utah, and Tennessee, all working on pilot programs or legislation supporting portable benefits. And while these concepts are being vetted in laboratories of democracies, outdated federal law still brings the threat of lawsuits preventing workers nationwide from accessing benefits. It's time we establish consistency and clarity for every worker so that those who wish to be independent contractors can not only have the flexibility and independence, but also the financial security. So I urge all of us, Democrat, Republican, to work together to achieve this goal, just as Democrats and Republicans on the state level are doing the same thing. I thank the witnesses for being here. Thank you all for representing your position. And I look forward to our discussion how we can empower workers to succeed. With that, I recognize Senator Sanders.
Thank you, Mr. Chairman. Thank you, panelists, for being with us. I don't have any good Uber stories. But what I do know is that in America today, we have more income and wealth inequality than we have ever had in the history of the United States. We have a situation where the top 1% owns more wealth than the bottom 93%. CEOs of large corporations now earn 350 times more than their average workers. According to the Rand Corporation, not a socialist operation, over the past 50 years, $79 trillion in wealth has been redistributed from the bottom 90% to the top 1%. Today, quite unbelievably, the average American worker makes less in real inflation accounted for dollars than he or she did 52 years ago. So that's where we are right now. There are a lot of reasons for that that we're not going to get into today. But one of the more important reasons why the working class in America is worse off than they were 50 years ago, despite huge increases in worker productivity, is the fact that corporate America has been waging a war against the trade union movement for decades. According to the latest Gallup poll, 70% of the American people support labor unions, and yet only 6% of private sector workers belong to one. All over the country, people want to join unions, and yet in the private sector, mere 6% are in unions. Unfortunately, Mr. Chairman, I'm afraid that the bills that we are considering today would only make a bad and unfair situation even worse. These proposals would make it easier for large corporations to misclassify workers as independent contractors in order to avoid paying them decent wages and decent benefits. These bills are not about giving workers the freedom to work. These bills are about giving corporations the freedom to deny workers the right to form a union. They're about giving corporations the freedom to pay workers poverty wages and denying workers the overtime pay that they are owed. In other words, they would give corporations like Amazon, Uber, and Lyft the freedom to exploit their workforce. The reality is that the safe harbor provisions included in this legislation would give large corporations a blank check to break our nation's labor laws. A few years ago, I met with truck drivers in California who were misclassified as independent contractors. Never forget that. Big lineup of trucks near the harbor. One truck driver told me he worked 100 hours a week, and not only did he not get paid for that work week, he ended up owing the company a check. What was his crime? The trucking company forced him to lease the truck he was driving for an outrageously high fee and then fired him for speaking out against that injustice. And that's happening all over the country. At yesterday's hearing, we heard concerns from Senator Hawley about how Amazon drivers are misclassified as independent contractors and denied the right to form a union, even though they wear Amazon vests, drive Amazon vehicles, deliver Amazon packages, and have their work schedule controlled by Amazon. He was right. Instead of denying workers the right to form a union, we should make it easier for workers to organize and bargain for better wages and benefits. Virtually every major union in this country supports the PRO Act, the right for workers to join a union without being illegally attacked by their employer. Mr. Chairman, I ask unanimous consent to enter into the record letters opposing these bills from the AFL-CIO, the SEIU, the National Nurses Union, United, the National Employment Law Project, and others.
Without objection.
Instead of denying workers the right to decent wages, we should be raising the minimum wage to at least $17 an hour. Instead of denying health care to workers with pre-existing conditions, we should do what every other major country on earth does, guarantee health care to all people as a human right. And if we're serious about addressing the retirement crisis, which is what we're talking about today to some degree, the way to do that is to bring back defined benefit pension plans. Now, I know that a lot of young people in the audience may not even know what a defined benefit pension plans. Guess what? Your grandparents, when they went to work, if they worked for a large company, when they retired, they had a pension plan. They knew exactly how much they were getting for the rest of their lives. According to the Congressional Research Service, in 1975, 44% of private sector workers in America had a defined benefit pension plan that guaranteed a monthly income in retirement. Today, that figure has dropped to just 9%. This is the wealthiest country in the history of the world, and we should not have millions of people reaching retirement age with nothing in the bank, worrying about how they're going to make it through their last years on earth. And that has got to change, and that is why I've introduced the Pensions for All Act this morning. This legislation would provide comprehensive retirement coverage to the more than 56 million working-class Americans who currently have no pension plan through their employer. If we can guarantee a defined benefit pension plan for members of Congress, not a bad plan, guys, we can and must provide that same level of retirement security to every worker in America. That is precisely what this legislation would do, and I am proud that it has the strong support of the UAW, the Alliance for Retired Americans, and the Association of Flight Attendants. I look forward to hearing from our witnesses. Thank you, Mr. Chairman.
Thank you. And so now we'll hear from our witnesses. I'll first introduce Patrice Onwuka, who is the director of the Center for Economic Opportunity at the Independent Women's Forum. Ms. Onwuka is an expert on economic and employment issues and has written extensively on independent work. She's a senior adjunct fellow with the Philanthropy Roundtable and a Tony Blankley Fellow at the Steamboat Institute. She holds a bachelor's degree in economics and political science from Tufts and a master's degree in international relationships from Boston College. We look forward to hearing from you today. Thank you, ma'am.
Thank you, Chairman Cassidy, Ranking Member Sanders, and the members of this committee. I appreciate being invited to speak today. My name is Patrice Onwuka, and I'm director of the Center for Economic Opportunity at Independent Women. We advance policies that enhance people's freedoms, opportunity, and well-being, and we have a special focus on women's opportunities. Flexible work through independent contracting is critical to women's labor force attachment. Independent workers value the ability to work for whom they want, when, where, and how they choose. They do not want to lose that flexibility, yet some of them lack access to benefits such as health care by the nature of this 1099 work arrangement. This creates economic and health vulnerability and disincentivizes entrepreneurship. But Congress can overcome some of these challenges by avoiding mass reclassification of workers through stringent employment tests, and instead harmonizing the independent contractor definition across federal agencies with a clear and simple test. Also, create a safe harbor so that organizations and companies can offer portable benefits to independent contractors without triggering misclassification. I'll share more on this with you today. No worker should be forced into a traditional 9-to-5 job. Freelancing and self-employment are long-standing work arrangements in the United States. An estimated 70 million people freelanced, nearly half of them women. Over 80% of independent contractors said they prefer their work arrangement over traditional employment. And flexibility is the driving force. People are raising children, caregiving for aging parents, and managing their own health issues. Others find independent contracting as an entry into entrepreneurship. When we look at women, 9 out of 10 female workers who left full-time employment did so because of flexibility, like Jeanette Lonergan, a long-haul freight driver who serves as the primary caregiver for her father-in-law while she's working a full-time job. So independent contractors want, and in some cases need, to remain independent because of their unique circumstances. Today, employer-provided health care is the predominant source of health insurance for working-age adults. And for many American workers, that is fine, but it is out of the reach for independent contractors by law, even would-be entrepreneurs. 20% of them say that they've abandoned the idea of starting a business because of fear over losing health insurance. Now, not all flexible workers are the same. According to the IRS data, the largest share of independent contractors are supplemental earners who have full-time jobs elsewhere and may also have benefits, employer-provided benefits. Yet there's a meaningful share of independent contractors who do not because they don't have that full-time work or a spouse that has health care coverage, and they would benefit from some kind of option. Now, mass reclassification is the wrong solution to this problem. Expanding healthcare benefits by forcing independent contractors to be reclassified as employees is ill-advised and undermines workers' choices, their freedoms, and their labor attachment. The Protecting the Right to Organize Act utilizes an ABC test, while the Department of Labor's independent contractor rule, finalized in 2023, uses a multi-factor test. But both approaches effectively would reclassify millions of independent contractors against their wills. When California did so, we saw the devastating impacts. Self-employment fell 10.6%, and overall employment fell over 4%. Entire professions were wiped out, and professionals were left with nothing to show for it. Jessica Tucker, for example, she was earning $60 an hour as a transcriber. She says, AB5 took this away from me, and my family has been struggling to put food on the table ever since. Portable benefits, though, are the right way forward. They respect independent work status. They stay with the worker instead of with a specific employer, and workers can get access to lots of different benefits. But federal law prohibits companies and individuals from being offered this, and so a safe harbor in federal law would make it possible for portable benefits to be offered. And the support, public support, is strong. At Independent Women, we released polling this year that found 82% of women said the government should not force people to work 9-to-5 jobs. And an even higher share, 87% of women and 83% of adults, say the government should make it easier for independent contractors without traditional employment to get access to affordable health and benefits. States aren't waiting for Washington. We've seen it in Utah, Pennsylvania, and other states, Alabama, Tennessee, Georgia, Wisconsin. So key bills that can overcome these hurdles, well, the Unlocking Benefits for Independent Workers Act, and similarly, the Modern Worker Security Act, as well as the Worker Empowerment Act. Policymakers, you all have an opportunity to harmonize the independent contractor definition across federal law, and even more, to unlock portable benefits for independent workers without sacrificing their freedom. Thank you.
And thank you for staying in the 5 minutes. You know, you kind of stuck it like a gymnast, so anyway, thank you.
It's the radio work.
Next, we're joined by Kim Cavan, a freelance journalist who became a full-time freelance writer and editor in 2003, previously spending nearly a decade as a staff editor for daily newspapers and monthly magazines. Ms. Cavan also co-founded the nonpartisan group Fight for Freelancers to advocate for independent workers. She writes a Substack on this issue. Ms. Cavan is a graduate of the University of Missouri Columbia School of Journalism, and thank you, ma'am, for testifying.
Thank you, Chairman Cassidy and Ranking Member Sanders, for the chance to speak on behalf of America's tens of millions of independent contractors today. My name is Kim Cavan. I'm from New Jersey. My parents were public school teachers, and I grew up in a proud union household. I earned a journalism degree from the University of Missouri, and I had staff jobs at newspapers and magazines until I was about 30. That's when I realized some freelancers were earning more than I was. It's one reason I chose to go freelance 22 years ago. Now, I'm 53. Freelancing is one of my best life choices. When Gallup says 2/3 of Americans want to be their own bosses, I get it. You can count me strongly among the 80% of independent contractors who prefer this way of working. It was alarming to all of us in 2019 when California passed Assembly Bill 5. The claim was that AB 5 would stop employee misclassification, but it went way beyond that. The regulatory language hurt independent contractors across more than 600 professions. When New Jersey tried to copy AB 5, some friends and I created a coalition called Fight for Freelancers. We packed our state house for a standing room only public hearing where we testified for more than 4 hours straight. Women, men, people of all races, ages, people who had voted for you, Senator Sanders, and for President Trump. All of us stood shoulder to shoulder fighting for our freedom to earn a living. We won, and ever since, we've been fighting to stop this lunacy nationwide. I respect people who choose traditional jobs and unions, but I do not see that same respect being given to independent contractors. Instead, we're being forced to fight the PRO Act in Congress. We had to sue the U.S. Labor Department, and our friends in California are still suffering. AB 5 is such a disaster that Governor Gavin Newsom's former deputy chief of staff said it's truly horrific how many people are negatively impacted by it. The Trump administration's deputy U.S. Labor Secretary called it catastrophic. Members of the California Advisory Committee to the U.S. Commission on Civil Rights warned that it disproportionately and negatively affects women, immigrants, people of color, and the politically powerless. A California assemblyman is asking the U.S. Department of Justice to investigate. It's just bad policy. California's pace of job creation tanked by 81%. Union membership went down. Self-employment for affected professions took a 10.5% hit. Overall employment dropped too. And right now, the state of New Jersey is trying to create AB 5 on steroids. Attorneys say a proposed rule almost entirely eviscerates any chance of being an independent contractor, while the state itself says the rule won't create a single job. This is not targeting employee misclassification. This is weaponizing regulatory language to attack independent contractors. We just had another public hearing in Trenton, and it was standing room only, again, for more than 3 hours in a heat wave. The chief legal officer at Prudential, with headquarters in Newark for 150 years, said what's happening may be impossible for them. AAA's witness said it could jeopardize public safety by impairing roadside towing. The president of the bi-state motor carriers, who's sitting right behind me today, said this would cripple the port of New York and New Jersey. It went on, and there was a new talking point. This is not unions versus independent contractors. But just as we see at this table here today, every single witness for this in New Jersey was employed by unions or affiliated with organizations that have strong union ties. I listed them in my written testimony, and I can provide video. I also detailed how some of their so-called research is highly questionable. Some of it seems purposely mischaracterized, including in a government report. You're going to hear a lot today about how employee misclassification is wrong. That's true. But it's equally wrong to reclassify independent contractors right out of business. We shouldn't need a law to protect our freedom to be our own bosses, but here we are. Please pass the Modern Worker Empowerment Act and end this madness once and for all.
Thank you. Next, our next witness is Kev Coleman, a research fellow at Paragon Health Institute. Mr. Coleman is an expert on the topic of health insurance, and which is a major focus of today's hearing, association health plans. His expertise provides a critical perspective on affordable health care options for independent workers. He holds degrees from Eastern Nazarene College, Yale University, and Duke. I look forward to hearing from you today. Thank you for being here, sir.
Chairman Cassidy, Ranking Member Sanders, and members of this committee. My testimony is intended to illuminate briefly the small business needs for association health plans, otherwise known as AHPs, and the ways by which AHPs can satisfy those needs. My name is Kev Coleman. I'm a research fellow at Paragon Health Institute, an independent, nonpartisan policy research organization dedicated to reforming government and empowering patients. Prior to Paragon, I worked largely in technology startups, including co-founding Association Health Plans, Inc. My testimony today represents my views alone. The National Federation of Independent Businesses 2024 survey reported health insurance cost remains, quote, the #1 small business problem, a position it has held since 1986. For small businesses, the past decades have brought increased revenue or insurance expense and declining coverage availability for its workers. Almost half of small employers offered health coverage back in the year 2000, but by 2023, that percentage had fallen to 30%. Within this period, there was also significant decline in the use of small group health insurance. National Association of Insurance Commissioners data shows covered lives declined by nearly a third from 2014, the first year of Affordable Care Act small group insurance coverage, until 2023, the most recent year for their published data. Government data for the same period found small business cost of single coverage rose by 35%, and family coverage rose by 37%. AHPs offer relief to this situation. Technically, an association health plan is not a type of insurance, but rather a legal instrument by which a group of businesses can band together and cooperatively sponsor a single health plan limited to their own workers. Assuming their aggregated employees is of sufficient size, the AHP can access the large group health insurance market, a market that already covers over 80 million Americans. There are many antecedents for AHP's cooperative arrangement, such as credit unions, professional employer organizations, and group captives. Such organizations employ similar strategies where demand for products or services is pooled among multiple businesses who voluntarily work together to secure lower prices. A primary way large group health plans achieve savings is scale. For example, large group plans covering thousands of employees are in a better position to negotiate with insurers because a large plan offers an insurer a bigger risk pool over which health claims may be moderated. Large group plans also pay less for the same benefits because of rules on their medical loss ratios and practices around actuarial load. In the brief 2018 period when reforms expanded AHP access, new AHPs provided both broad health benefits and double-digit savings. In my own research of nearly 36 of these plans, the highest savings reported for a fully insured plan was 23% and 29% for a self-insured plan. Separate research found savings examples like the Tennessee Realtors AHP that reported savings of 25 to 50%. Likewise, at the time, Avalier Health's market projections had predicted future AHP premiums were substantially lower than those in the small group and individual markets. The 1974 Employee Retirement Income Security Act, known as ERISA, codified AHPs as a subtype of multiple welfare arrangements. In the decades since ERISA's passage, AHP regulation has improved consumer protections on the federal as well as the state level. Congress amended ERISA in 1983 to give states authority to regulate self-insured AHPs. States, for their part, have enacted numerous laws and regulations to improve AHP governance and oversight in the decades since this amendment. On the federal level, HIPAA guarantees that an eligible employee may not be denied AHP coverage based on health factors. Specifically, it's prohibited from denying coverage based on health status, pre-existing medical conditions or mental illness, medical claims history, and genetic information. Opponents of AHPs have sought to prevent access to large group health insurance by small businesses. However, these foes of AHPs are oddly silent regarding why large group coverage is acceptable for big businesses, universities, and nonprofits, but not traditional small businesses and the self-employed. This double standard is all the more problematic given the excessive insurance prices small businesses pay. Thank you for the opportunity to testify today.
Thank you. Senator Sanders to introduce his witnesses.
Thank you, Mr. Chairman. I'd like to introduce Tim Driscoll, President of the International Union of Bricklayers and Allied Craft Workers. Mr. Driscoll first joined the Bricklayers Union in 1985 as an apprentice. He has served in several leadership roles with his union and was elected president of the Bricklayers in 2020. Mr. Driscoll, thanks very much for being with us today.
Thank you, Ranking Member Sanders and Chairman Cassidy. Thank you. I'm here today on behalf of BAC, the International Union of Bricklayers and Allied Craft Workers. Today's hearing, as I understand it, is an examination of proposed legislation that seeks to address the accessibility, portability, and security of benefits for workers and those who may indeed work for multiple firms and at times need to work across state lines. I'm well acquainted with the needs of such workers because BAC members, along with millions of other building trades workers, find it necessary to work for multiple employers, often across various jurisdictions throughout the year, and the availability and security of benefits is a core concern for our members. My union is dedicated to strengthening laws that protect workers and the benefit systems that they rely upon. Unfortunately, the Unlocking Benefits for Independent Workers Act falls short on both these counts. Misclassification of workers as independent contractors is rampant in the construction industry and other sectors of our economy. It provides low-road employers the ability to mistreat workers as contractors, denies those workers the essential protections afforded to employees, and deprives state and local governments of the tax revenue that such employment should generate. The Unlocking Benefits for Independent Workers Act would only accelerate this insidious race to the bottom by providing unscrupulous employers a safe harbor under all federal laws when such companies provide employees any benefit or protection that's commonly provided to employees. This unnecessary expansion of independent contractor status would leave affected workers without the basic protections of the Fair Labor Standards Act and would make it next to impossible for them to exercise their ability to form unions or bargain collectively under the National Labor Relations Act. This proposed legislation is an extreme departure from the benefits and protections that workers have relied upon for decades and is a thinly veiled attempt to weaken the rights of workers to join unions, to be paid fair wages, and to have safe working conditions. Similarly, Senator Scott's Modern Worker Empowerment Act would narrow the test for employees under the FLSA to the usual common law rules and thereby expand the ability of unprincipled employers to misclassify workers as contractors. Congress was clear when it established the FLSA that people working for someone should enjoy the benefits and protections afforded by the Act. This broad scope, laid out under the economic realities test, has been established through decades of case law and rulemaking. However, the modernization promised by the proposed bill is an open invitation to opportunistic employers who would exploit workers and deny them the most basic protections that the Act guarantees. Rather than spend time on disingenuous efforts, Congress should instead focus on passing the Protecting the Right to Organize, or PRO Act, so that all working people have the freedom to join together, negotiate with their employers for better wages, benefits, and working conditions. Research consistently shows that when union density is strong, whether in specific regions or occupations, it leads to better wages, improved benefits, and a higher standard of living for entire communities. Unions achieve this by uniting workers to bargain collectively for improved standards at work, standards that benefit non-union workers as well. Robust unions help set wages for entire industries and occupations. They reduce wage disparities by ensuring fair pay and bring living wages to underserved communities. Crucially, for today's proceeding, the PRO Act offers vital solutions to the challenge American workers face. It guarantees bargaining rights for employees who are misclassified as contractors and establishes a process for helping newly organized workers achieve a first contract. These are the real policy solutions that face American workers. These are the solutions that provide workers a real voice on the job and empowers them to secure the benefits they need. These are the true reforms that workers across our country need today. Thank you again for the opportunity to address the committee and speak on behalf of American workers this morning. I look forward to answering any questions that the committee may have.
Mr. Driscoll, thanks very much. I'd now like to introduce Karen Friedman, the Executive Director of the Pensions Rights Center. Ms. Friedman has worked for over 20 years to advocate for workers and retirees. The Pensions Rights Center conducts important work to find innovative solutions to the retirement crisis facing working Americans. Ms. Friedman, thanks very much for being with us.
Thank you so much. Good morning, Chairman Cassidy, Ranking Member Sanders, and members of Congress. Thank you so much for this opportunity to testify today about expanding coverage to the millions of private sector workers who are not now covered by an employer-sponsored plan. The Pension Rights Center, which was founded in 1976, is a national, nonpartisan consumer organization that works to promote and protect the retirement income security of workers, retirees, and their families. We work on sort of two different directions. Our policy program works to identify and address gaps in the retirement income system and work for innovative solutions. Our legal program is the go-to place for individuals when they need help with a pension or a 401k type plan. On that score, the Pension Rights Center is proud to be the resource center for 6 regional pension counseling projects, which provide free, hands-on assistance to individuals in 31 states, helping them address their retirement income problems to ensure they get the benefits they've earned. Since the inception of the program, which is funded by the Administration for Community Living, the counseling projects have provided and helped more than 70,000 people, recovering some $294 million in earned benefits. PRC's passion, and my passion, is to help people and ensure that everyone can retire with secure income. Since our founding, we've heard from tens of thousands of people from across the country who tell us how they're suffering, struggling in retirement because they cannot make ends meet. Why? Some don't have a pension. Many don't have enough money saved in their 401k plans, and an alarming number don't have a retirement plan at all. To top it off, the average monthly Social Security benefit in 2025 is less than $24,000 per year. With so many people living on just that modest Social Security benefit alone, over 5.7 million older Americans are living in poverty. That's why it's so vital that we not only ensure pension coverage for all American workers, but we also need to work to strengthen and expand Social Security, which is America's most important anti-poverty program. Just yesterday, I was talking to Cindy. She's a woman we've helped for many years. She lives in Kansas City, Missouri. She said something incredibly astute. And actually, it's very similar to what you said, Senator Cassidy. She said, Karen, when you're talking to the senators tomorrow, remind them that retirement security is not a partisan issue. It's not a Republican issue. It's not a Democratic issue. It's an American issue. She continued, we are all united in wanting to have sufficient money after years of hard work so we could pay our bills, stay part of our communities, support local businesses, and help our kids and grandkids. The great part is Cindy can do all that because her husband has a good defined benefit plan, which she thinks everyone should have. According to the National Institute of Retirement Security, a poll that they did, people across party lines agree with Cindy, with 80% of Americans saying that all workers should have a pension so they could be independent and self-reliant in retirement. Sadly, that is not the case for most people. In fact, polls show that running out of money in retirement is a top concern for all Americans. A poll from Alliance Life Insurance shows that 64% of Americans are more worried about retiring without adequate income than they are about death. So that's a pretty amazing statistic. Unfortunately, the facts support people's fears. Just half of private sector workers participate in an employer-sponsored retirement plan. Even for those who are covered, there's been a dramatic shift from defined benefit plans, which provide secure, guaranteed lifetime income, to less secure 401k plans, where individuals are not saving nearly enough money to make it through retirement. To that end, PRC has developed policy principles, which are included in my written statement, that we think should be used to evaluate any legislative proposal that aims at bolstering retirement income, particularly for low and moderate wage earners. In short, our top 4 principles for new proposals are these: universal coverage, secure income, adequate income, and retired contributions from employers and employees. Ranking Member Sanders, we applaud you for introducing the Pensions for All Act, which embodies these principles. Your visionary bill is modeled on the pension plan provided to new members of Congress. I think that workers of all views appreciate the value of this type of pension and feel that every American deserves no less. Your bill is aspirational and an inspirational challenge to all of us to think big. Thank you again. I guess I've just run out of time. Thank you again for inviting me today. Thank you. Thank you for inviting me today, and I'm happy to answer your questions.
Thank you. That's right.
Okay, thank you so much.
United here. Everybody wants the motto of my office, we want to be pro-family, pro-worker, pro-patient. I think each of you could say that. Now, the question is, how do we get there? And we want that person, our fellow American, to retire with adequate benefits. As an aside, by the way, Ms. Friedman, I agree with you regarding social. And one thing that we've ignored so far is that in 8 years, there'll be a 20% cut by law in social benefits. Senator Kaine and I have a bipartisan bill that would attempt to address that, even increasing benefits for those at the lower income scale. That's not this committee, but I just want to mention that because Social Security getting a cut of 20% would be anti-worker, anti-patient, anti-family. So that said, Now, I'm going to speak to the two of you, please. Senator Sanders pointed out some things we should be concerned about. Increasing wage inequality, disparity. And his prescription is, as we heard. But in California, both of you referenced how AB 5, ostensibly that was going to improve things for workers, ended up with lower employment overall, not just among independent workers, but if I read your testimony correctly, Ms. Cavan, among union workers too. Yeah, so why don't you start, Ms. Cavan, real quickly, because I only have limited time, and just speak to what seemed to be, oh, we're addressing this, and probably California has the greatest disparity between CEOs and workers. We ended up with workers being worse off.
That's right. The union data that I cited came from the U.S. Bureau of Labor Statistics. And if you look at the chart, you can see the line going straight down. Talking about what I said in my opening statement about I went freelance because I thought I could earn more money, accurate. That turned out to be true for me, and it turns out to be true for a lot of people. One of the most recent studies that just came out on that was Upwork. They looked at the skilled freelancers who are performing knowledge work. We brought in about $1.5 trillion in 2024, and more than a quarter of us in the United States are freelance. Those who earn exclusively through freelance work report a median income of $85,000, surpassing their full-time employee counterparts at $80,000.
Include the benefit of, Mr. Driscoll would probably ask, does that include the benefit of benefits? If you say 20% of your income goes towards benefits, is that 85K accounting in that differential, accounting for the fact that the person who's full-time employed has benefits as well?
Well, we have to pay for we don't get access to those good, juicy group rate plans. That's what you're trying to fix, and Senator Paul is trying to fix for us. I actually brought my health insurance stub, my monthly pay stub that I have to shell out to get silver level, not even gold, Blue Cross plan in New Jersey, $999.87 a month just to get access to the health care. That's supposed to be affordable health care? No, it's not. And I took a little poll.
Is that through an exchange?
We have to buy independent individual plans. And I took a poll among independent contractors that I know. Some of them are getting jacked for $2,000 a month. If they have kids, $3,000 a month. Premiums. These are premiums. This isn't even going to the doctor and getting something done. And a lot of us do well as freelancers, and yeah, we have to pay more for the health insurance because the rules have to be changed.
How would you comment upon this?
I mean, to the point that in California, the fact that the original bill had to exempt over 100 different occupations because it was so sweeping. And then even after that, you have 600 occupations full of tens of thousands of Californians who are still under the gun of AB 5, and they have lost incomes, they've lost contracts, they've lost livelihoods, they've lost small businesses. I've spoken to a woman who had a breast cancer survivor. She was raising 3 children while starting a business, and AB 5 in 2019, it really helped to push her out of business. So when you talk about mass reclassification, which is what this effort really is, it's a sweeping effort to try to consider every single independent contractor in every occupation as the same. And sure, there may be misclassification in some industries, but it's concentrated in some industries, and you're penalizing a lot of people who do not want to be penalized.
So, Mr. Coleman, Ms. Cavan spoke about those premiums being so high, but the association health plan, by pooling risk, how do you estimate that would lower the potential premium, health insurance premium for such a worker? And be quick, please.
It would lower it potentially by thousands over an annualized period, depending on factors of location, age, et cetera.
Well, it would lower it by thousands depending upon those factors, but within each location, theoretically, it would lower it, correct?
Right. I was just making accounts for differences in the local cost of health care.
I'd like to ask you two, but I'm out of time, and I'll defer now to Senator Sanders.
Ms. Cavan, Mr. Coleman, you talked about the burden of healthcare costs on small business. Absolutely right. Ms. Cavan, you told us that healthcare in America is expensive. Yeah. In fact, it is double what it is in most other countries around the world. So I would ask our panelists very briefly, yes or no, do you think it makes sense for the United States to join every other major country on earth guarantee health care to all people as a human right. Ms. Oakham?
Ms. Onwuka, you mean, sir, not the way you're suggesting, no.
Okay, thank you. Ms. Cameron?
I agree, not the way you're suggesting.
Mr. Coleman?
I don't think the question really understands the philosophy of human rights versus localized market.
Despite the fact that every major country on earth guarantees health care to all people.
Yes.
Mr. Driscoll?
Healthcare is absolutely an essential right everyone's entitled to.
Ms. Friedman? Mr. Driscoll, you state in your testimony that the misclassification of workers as independent contractors is rampant in the construction industry and has led to a destructive race to the bottom. Please tell us how this has harmed construction workers and why you believe Congress should not make it easier for corporations to misclassify workers as independent contractors.
Yeah. Currently, under existing law, Senator Sanders, approximately 2.1 million workers are misclassified as contractors. So within my trade, a bricklayer working next to another bricklayer, working on a project that they have no control over, are often deemed contractors to avoid paying unemployment insurance, health insurance. That cost is ultimately borne by the community that those workers participate in because they cannot afford health care. And it drives a race to the bottom where our employers, responsible contractors who provide health care and pension benefits, can't compete against these low-road contractors. This law, if enacted under its current language, would simplify that test and lead to an expansion of those type of contractor relationships.
President Driscoll, the bills we are discussing today would give companies a quote-unquote safe harbor that would allow them to deny workers a minimum wage, overtime, and the right to form a union. In your opinion, would these quote-unquote safe harbors help or harm workers?
These would greatly harm workers, Senator.
Ms. Friedman, astoundingly, again, we are the wealthiest country in the history of the world, and yet nearly half of older workers have no retirement savings. I've introduced legislation today that would bring back defined benefit pension plans for over 56 million American workers. Ms. Friedman, what would it mean if every American had access to a defined benefit pension like the one members of Congress have?
Senator, it's a great question. As I said in my statement and in my written statement, defined benefit plans, which are guaranteed plans that provide lifetime payments to individuals, have created a middle class in this country. If everybody had a defined benefit plan, then they'd be able to pay their bills, they'd be able to take care of themselves and not be a burden on society. They'd be able to participate in community.
I'm going to interrupt you here.
Yeah,
but
sure.
Isn't it fair to say, and I trust that nobody disagrees with this, that if you are 60, 65, you're about to retire and you got nothing in the bank, which is the case for millions and millions of people, there is a tremendous level of anxiety. How do I survive?
Yeah, totally.
And one of the astounding facts, we don't talk about it, I learned about it, Mr. Chairman, just last year when I was sitting where you are. 22% of seniors in America are trying to survive on $15,000 a year. Right, that's insane. All right, so what we are striving for here, and you tell me, Ms. Freeman, is a defined pension plan so that when people retire, they know what they're going to get. Also, let me talk about Social Security. The chairman correctly mentioned we have a problem with Social Security. Right now, why don't you tell people, if somebody is making $10 million a year and somebody's making $160,000, $176,000, who pays more into the Social Security Trust Fund?
Well, if somebody, so
One's
millionaires,
paid $10 million, one's
the lower income person pays much more
A higher
into
percentage.
Social Security, exactly.
Because we have a cap.
Right.
And what would happen if we lifted that cap to for all taxable income? The legislation that I have introduced would greatly expand benefits and increase the solvency, the issue Senator Cassidy talked about, for 75 years. Does that make sense to you?
Yes, it certainly makes sense to me, and the Pension Rights Center also thinks that it's a great idea. You know, Senator, if I may just add, Social Security is this country's nearly universal pension plan, and it's completely portable. It's extremely efficient. It's spending less than a penny on administration of every dollar spent and returning more than 99 cents of every dollar in benefits. And these benefits have not been
Thank you.
increased. So yeah, so it's a great thing. Yeah.
Senator Tuberville.
Good morning. Thank you, Mr. Chairman. Thanks for the witness for being here today. Regardless of what you think about all this, this is a bipartisan issue. Outside the Beltway, left-leaning groups and forward-thinking unions understand the reality that the vast majority of independent workers want to work independently and they want access to benefits. This is the 21st century, last time I looked. It's not our job in Washington, D.C. to tell workers what they want. It's not our job. To that point, I'd like to request to enter into the record, Mr. Chairman, a couple of letters here by SEIU 775 and a press release by Teamsters Affiliated Drivers Union, which includes a statement by Teamsters Local 117 in Washington State, all in support of portable benefits for gig workers.
Without objection.
Thank you, Mr. Chairman. Since President Trump's taken office, we have been seeing consistent job growth, but we can't sustain this growth and bring new industry to our communities if those companies don't have flexibility to offer benefits their workers want. They want it. Our labor laws are outdated. In order to grow and upgrade, American workers must be in charge, the workers. That means giving independent contractors, freelancers, and gig workers the freedom and confidence to work how they want and take care of themselves and their families. What an idea. Gone are the days where our American workers want to spend 40 hours a day, 40 years working on the same assembly line at the same factory. That's over with. Day in and day out, they can't. That's not going to be sustainable. America's future workforce wants the freedom of flexibility and the opportunity to still provide for their families while pursuing different jobs that work for them and their schedules. Republican and Democrat states alike are passing bills providing more freedom to independent contractors and their benefits, including my state of Alabama. Mr. Coleman, there's been a lot of conversation with my colleagues in this chamber over the last few months about making sure that Medicaid is going to people that really need it. And that sparked a conversation about how and where Americans get their health care coverage. If businesses were provided a legal avenue to offer portable benefits to independent contractors, how would that fit into the landscape of uninsured and insured Americans seeking health care?
Thank you for the question, Senator. Obviously, it would create a positive effect with respect to insurance. By expanding small businesses' ability to offer affordable health insurance to its workers, we could hopefully reverse the decline we've seen in the offer of coverage among small businesses. As I mentioned earlier in my testimony, we have a situation where, back at the turn of the century, nearly half of small businesses offered insurance to its workers. We're now in a situation where that has plummeted to 30.1%, if memory serves well.
Thank you. Ms. Kevin, your will and passion for protecting independent contractors is a byproduct of why we're having this hearing today. Millions of Americans are facing the same issues that you have faced. I am proud to co-sponsor Chairman Cassidy's bill, Unlocking Benefits for Independent Workers Act, to help these millions of Americans. Can you talk to me about your grassroots coalition, Fight for Freelancers, and explain what freelance business busting is?
Freelance busting is a term that I came up with while I was doing yard work one day and listening to a podcast about union busting, and they seemed to think that anything that happened that unions didn't like fell under the term union busting. And I said, well, we need to call what's going on against us freelance busting, because they seem to be trying every which way from Sunday to figure out how to knock us out of business and cause us harm. My coalition, which is I'm a co-founder, not the founder, we are fully bipartisan. We have people from every political stripes you can imagine who have voted for everybody under the sun. We do not believe this is a partisan issue. We are just people who choose to be our own bosses. This has been legal in the United States since the day this nation was founded, and we are sick and tired of having to fight our own government. Keeps trying to take that freedom away.
Thank you. Ms. Onwalka, as far as benefits like health insurance, workers' compensation, retirement benefits, I'm interested to know what the landscape actually looks like. So ballpark, how many workers currently lack access to employer-provided benefits because they are part-time employees or independent contractors?
So some of the research that I've seen is anywhere between maybe 20 to 30% of those independent contractors don't have any access to benefits, either because they don't have a full-time position elsewhere or because they're not covered by a spouse, for example.
Yeah. Thank you, Mr. Chairman.
Thank you. Now, Senator Hassan.
Thank you so much, Mr. Chairman, and thank you and Ranking Member Sanders for this hearing. And to our witnesses, thank you for being here today, for sharing your experience and your expertise. I really appreciate it. I will just say, as we are discussing the importance of making sure that workers have access to health care, retirement, and other benefits, it is worth pointing out that it's been less than 2 weeks since President Trump and congressional Republicans unilaterally voted to take away the health care of millions of Americans. So I find a little bit of irony in this moment today. I also really appreciate the focus on how to address the need to update our rules and laws to reflect a modern economy. But the thing is, the devil is in the details here, and the details really, really make a difference. Because if you have sat where I sat as governor of a state and talked to a lot of people who've been forced into independent contract status, that 18-year-old kid hired by a contractor up on a roof, falls off the roof, breaks his back, and has no workers' comp and no insurance, so the rest of us bear the cost of that, that's a real issue that we have to think about and be careful about. And when we think about association health plans, we have to make sure they're not association junk health plans. Because if all you've got is people with illness and injury in the pool, that's going to drive the cost of that pool up, and they're going to discover they're not covered for a lot of things. So we got to get the details right here. Let me start with a question to you, Mr. Driscoll. President Trump's budget law will result in millions of Americans losing their health care insurance. This bill will also cause health insurance premiums and costs to go up for patients who receive insurance through their job, because the increase in the number of uninsured people turning to emergency rooms for care will drive up costs for all Americans. So, Mr. Driscoll, how will increased health care costs impact the workers that you represent?
As you indicate, the devil is in the details. There's no question there will be cost shifting from what's projected to be the 20 million folks who will lose their health insurance coverage, and that will be the insured plans, such as ours, that will have to absorb those costs.
Yeah, insurance companies, providers are going to begin to need to drive up premiums in order to cover the uninsured costs. Ms. Friedman, women face many obstacles for saving for retirement, including that they're more likely to come in and out of the workforce due to caregiving responsibilities. According to a 2024 survey by the National Council on Aging, less than half of the women and only 1/3 of rural women reported having saved for retirement. Can you speak to the unique circumstances that women face in saving for a secure retirement?
Yes, thank you so much for that question, Senator. It's absolutely true. First of all, as I've talked about, our efforts are working to make sure that everybody gets good coverage, everybody has portability. But and that's, Senator Sanders' bill, Pensions for All, would certainly address that along with other approaches. But as you're saying, that the data is abundantly clear that women do lag behind men in retirement income outcomes. There's lots of factors at work. Women still earn less for comparable jobs. They take more breaks from the workforce for caregiving. I know this because I was taking care of my parents. That leads to much lower lifetime earnings, which is going to affect how much they're getting. Widowhood, divorce and separation can disproportionately affect women's retirement income. All of those are really important factors. And also, women tend to live longer.
Right.
So they're going to have to make their retirement income last longer. So all these things are happening that we need to address. And I just want to also say that the Pension Rights Center supports Senator Baldwin's Women's Retirement Protection Act of 2025, and that addresses some of the big concerns that women have.
Yep. Thank you. I appreciate that. One last question for you, Mr. Driscoll. Union-negotiated portable benefit plans protect workers' rights while also supporting them with benefits that allow them to stay healthy, care for their families, and have flexibility in their work. What benefits do employers see with these types of plans, and how could we help more employers offer them?
Thank you, Senator. The beauty of these plans for our employers, and I want to clarify this up front, we have employers that employ hundreds, but in some cases we have employers who have 3 employees.
Right.
They get access to affordable health care with low administrative costs that no small employer could take on. Growing the rate of unionization in any given area or any given occupation would give more employers access to the benefits that I think they genuinely want to provide to their employees.
Well, thank you. And I'll also note that unions are also able to negotiate flexible schedules for their employees. Thank you, Mr. Chair.
And I will note that association health plans are regulated as large group plans are, and therefore have the same sort of requirements to avoid being junk plans. Next would be Senator Marshall.
Thank you, Mr. Chairman. Let's start with Mrs. Onwuka. Welcome, everybody. We appreciate you being here. Under a portable benefit model, what protections do workers have if a benefit provider were to go under or misuse funds?
Under a portable benefits plan, I mean, I think that there are protections in place to ensure that, you know, whatever investments have been made, whatever has been paid into it, that would still be there and protected. There's some great companies that have those accounts and set those up to ensure that, and they're regulated to ensure that that happens.
Have many of them failed, or has that happened very often?
I have not seen any of them failed, sir.
Okay, all right. Mr. Coleman, let's go to you next. I'm a big fan of association healthcare plans. It's something I fought for to help to become a possibility. I've seen some acceptance of it. I'm surprised it's not more so, to be honest. What's keeping that from exploding in a good way, and what do we need to do to put wind beneath those sails?
Senator, thank you very much for that question. A primary obstacle to association health plans underneath legacy regulation deals with the obstacles to be able to form a coalition of or an association of businesses whose aggregate employee body can be seen as a single health plan.
Okay.
There's something known as the look-through doctrine, which says if you don't have the right affiliations among businesses, we're going to treat each individual business within an association as its own entity with respect to health insurance, and hence if they have 3 people, they're in the small group.
Got it.
Health insurance.
So is this we need to change the law, or is it a regulatory issue?
Ultimately, changing the law is best because not only do you have the benefit of a very clear statutory precedent,
Okay.
but you also have a situation where technologists like myself or my former self are going to make investments in that market to build platforms, facilitating technology, et cetera. If it's a regulatory solution, there's more hesitation because there's the fear that the next administration may change regulation.
Okay, thanks. And I would just ask the committee staff, I'm sure you're looking at that, but would love to kind of understand what we can do to improve that situation as well. We've seen some
will
great
follow up
success
on
in Kansas with some of these plans, and again, I'm surprised there's not more people utilizing it. I'll go to Ms. Friedman next, and if you could just briefly explain that how under portable benefits can we be sure that employers are still providing benefits on par with many W-2 employees? I kind of messed it. Let me say it again. How under portable benefits can we be sure that employers are still providing benefits on par with many of the W-2 employees?
With portable benefits, well, there's lots of, look, portability has been an intractable problem in the retirement space. There's lots of proposals that will address this. Senator Sanders' Pensions for All would be portable. The state facilitated auto IRAs have some portability. I think we have to ensure that we're looking at solutions. I mean, what we're trying to do is address a concern, which is portability, people changing jobs a lot and benefits going with them. We need to be exploring those options and make sure that they're options that both protect employees and also are going to be.
Thank you. So I understand the problem. Now I'm looking for the solution. Ms. Onwuka, can you take a shot at that? How, under portable benefits, can we be sure that employers are still providing benefits on par with W-2 employees?
Well, that can be negotiated between the independent contractor and their client, really, who's able to pay in, just as in their contracts, they can define how much the employer is willing to pay this independent contractor on top of their negotiated rate, how much they're going to pay into that benefits plan. And they can match with whatever they're paying their W-2 employees in terms of the benefits that they're providing there. But let's not forget, these plans can be paid into by multiple different clients and different entities. So an independent contractor can really do well in terms of negotiating the kind of benefits package that works for them.
Typically, if you were doing that negotiation, and you have 7 or 10 clients or people you're working for, are you asking them to match like 10% or 20%? Is there kind of a range that you're looking for?
It would be up to that independent contractor to decide, sir.
Okay, all right, thank you, Mr. Chairman, I yield back.
And the next person is Senator Kim.
Thank you, Chairman. Thank you to the 5 of you for coming out and talking to us today. I wanted to just share, because it's very much on my mind, just the challenges my family's facing right now. My family's really struggling right now. My father's been in and out of the hospital 4 times since Father's Day weekend. He just had major surgery a few days ago, and I've been rushing back and forth from here to go see him, try to care for him. I'm the only family he has around. I know that things are only going to get worse. He doesn't know what country he lives in. He's got a lot of physical issues. And this is all accentuated by the fact that for a variety of reasons, my father was not able to save up for his retirement. Ms. Friedman, he's similar to what you were saying. He's one of those people that is getting less than $24,000 a year from Social Security, and that is the entirety of his income right now. So this is obviously not just affecting him, but it's affecting me. It's affecting my kids and what I can try to think about, be able to provide for them. So, Ms. Friedman, I guess I just wanted to ask you, because I'm struggling with this. I know a lot of people are. They feel that anxiety. I mean, I talked to workers in New Jersey. One woman told me there's so much challenge. It feels like it's hard for her to breathe right now. And I feel that right now as I'm talking to you. I want to ask you, just what suggestions do you have for us to think through how to ensure more people, especially those low and middle class, have access to retirement plans, and in the breadth of what we're talking about today in terms of independent contractors too?
Thank you for that question, Senator Kim. First of all, my condolences to you for all you're going through, because I had to do a similar thing with my family, and I know how hard it is. And families throughout this country are struggling right now. The fact is, 50% of the workforce, the private workforce, has no pensions or savings to supplement Social Security. So yeah, they're struggling. And my parents only lived on Social Security, so I know how that is. I think we have to explore solutions. One of the solutions, and I know you and I talked about it a little bit earlier, is looking at the state-administered auto IRAs for people who are not covered, working for pensions for all, Senator Sanders' bill, looking at our principles, seeing if there's other proposals. I mean, one of the things that the Pension Rights Center is trying to do is see if we can find, we're working from small to large, large to small, sort of supporting things like Senator Sanders' proposal, but also supporting the state-facilitated auto IRAs. We have to. And
so you think that makes sense to look into seeing how we can ensure that auto IRA effort can be expanded? I know it's in a number of states already, but trying to expand it to ensure that maybe independent contractors can better benefit from
Yes, I know a lot of the states, the state-administered auto IRAs actually include independent contractors, and I think that I think they aspire to all do so. I think we have to all work together, Senator Kim, and we look forward to doing that with the committee.
I hope so. I hope we can work together, because again, this is something on the minds of everyone. Ms. Cavan, we're from the same state here. Our state does have one of these auto IRA efforts underway, efforts to try to expand it to be able to more broadly include as well all forms of independent contractors. I'm just trying to think through the tools at our disposal. We're thinking through federal. I'm trying to think through just what's access to people. Is that something you see some value in? Do you think that there's opportunity where that can be able to provide some additional tools for independent contractors if we're able to sort of pursue that kind of auto IRA effort?
I think the first thing we have to do is protect our freedom to actually be independent contractors, and that is under attack both at the federal level and very much right now in our home state of New
I
Jersey.
understand that, and I take to your point, I want to make sure people have flexibility. I want to make sure that they can be able to live the lives that they want to live. And we will take that on here and have some tough conversations here, no doubt. But still, I'm just trying to think pragmatically. Is that at least something that you'd be open to exploring and seeing how that type of tool at the state level might be utilized?
I'm happy to meet with you and talk with you about anything you'd like. And I do feel for you with your dad. We're going through something similar. I had an aunt who just took a bad fall. She's a retired nurse who spent a few days in the ER. She was incredibly impressed with the traveling nurses, the independent contractors who helped her get better and get home. So again, what I say first and foremost is before we delve into all these specifics on other types of things, we need to protect the freedom for all of us to actually be independent contractors and earn a living.
Yeah, my mom was one of those nurses that worked at a hospital but then wanted to be able to have some more freedom, for her own, be able to do, home visits and other things of that, and trying to find different arrangements. So look, I see how that benefited her, allowed her to be the kind of mom she wanted to be. So let's continue to try to work together here and see what we can get done. And with that, I'll yield back.
Thank you. Very compelling, Senator Kim. Thank you for sharing your life. Senator Husted.
Thank you, Mr. Chairman. Thank all of our witnesses for being here today. I'm hopeful that this is one of those issues that we can have some great bipartisan progress on, because I think we all care about making sure that everyone in America has access to health care, but part of having access is being able to afford it. And we have a situation in this country where we spend far more. I mean, it's not for lack of effort in terms of how much it costs to provide health care that we're in this challenge. 18% of our economy is committed to health care. That's $5.26 trillion a year, far outpacing per capita what any other country spends on health care. But it reminds me, I grew up very rural. It reminds me when I was a little kid, I went with my dad to buy a used car. And when we walked up to the guy who had the car to sell, he said, my dad said, well, what do you want for the car? And he looked back at him and said, well, how much do you have? Right? If you don't know the price of something, pretty hard to know whether you're getting a good deal, have a negotiation. In this country right now, we have no idea what we're paying for health care when we're as consumers, whether you're an employer, an individual, somebody buying a health care program. None of us know. In most markets, we know. We know what the price is. We walk up, we know what not in health care. It's a mystery. None of us really know how much it is. And so that's, it seems to me that's a fundamental component of trying to figure this out. Mr. Coleman, you have thoughts on that?
Thank you so much for the question, Senator. I do have a lot of thoughts of that. I would say about 95% of my time now as a researcher is actually spent on the issue of the application of artificial intelligence within healthcare, because it's one of the most promising mechanisms we might have to be able to curb healthcare costs. People tend to forget that our insurance costs are largely I'm sorry, thank you, Senator. People tend to forget that our health insurance premiums are largely reflective of the costs of medical claims, and we need to find ways to be able to reduce the costs. Right now, the costs of our hospitals, our physicians, are way out of line with comparable nations in Europe. As you mentioned, 17.4% of our GDP is spent on healthcare. We need to look at that healthcare delivery issue, because that would really further enable the savings potential of the work we're discussing today on things like association health plans.
So additionally, when you think about labor unions, they come together, they represent their members, they negotiate for better wages, working conditions, health care, all benefits. But as an individual independent contractor, if I want to drive a car or have a small business, and Ms. Cavan, maybe you can answer this. Do I have the same ability to come together and negotiate under the law as you would as an individual, as an employee in a business or a union?
You're talking about the health plans?
Yeah, with health plans.
We need better access to the group rates.
Yeah.
this is not my personal area of expertise, but just asking everybody, knowing, I've been an independent contractor for more than 2 decades now. We're getting killed on these individual rates, and we need equal access to the group rate plans.
Yeah, Ms. Onwuka, do you have thought on that?
Nothing particular. They've said everything.
Yeah. Mr. Coleman?
I have much, the same opinions, that we need to find ways to be able to aggregate independent contractors so they have more leverage in negotiations on things like health insurance.
Yeah, because if you want to get a better price, you have to have the ability to know what the price is and improve your negotiating power so that you can figure out how to get the best deal for yourself.
Absolutely. It's literally the basis of the group health insurance market.
And we need to do better on that front. I just want to say that this is an issue of healthcare. When I think of small businesses, and we just passed, by the way, in the big beautiful bill, we help Social Security. We help small businesses. We help people have more money in their pockets to be able to pay for audit. But healthcare is going up. The cost is going up so fast. And if you don't have the ability, you make so many decisions in your life as a family member based on whether or not you can have health care, where you're going, where you are, where you change. And I hope that, Mr. Chairman, we'll work very closely together to improve the way that we're serving all of our customers, the people of the country. Thank you.
And I just want to note, Ms. Friedman has been saying that only 50% of workers have access to defined benefit or defined contribution plans. But I'll submit for the record a CRS report based on IRS data showing that almost 80% do. So just to point that out.
Thank you very much, Senator Cassidy. I'd like to suggest that I'm talking about 50% who participate in a plan. If you're talking about access, it's a slightly different issue.
Got it.
So yeah, I'd be happy to share that with you. But thank you very much.
Next is Senator Blunt Rochester.
Thank you, Chairman Cassidy, and thank you, Ranking Member Sanders, and to the panelists, thank you for being here. Delaware has recognized how crucial continued access to benefits like retirement are to persons' economic stability, and as we heard, even the economic stability of families. I was really struck, Ms. Friedman, by the remark that you made of individuals being more afraid of running out of money than dying. That really stuck with me. I can tell you this issue of making sure that, as you mentioned, Social Security was an anti-poverty program for our seniors, making sure that people actually can live out their lives with dignity and be able to feed themselves and be able to live is certainly important. And I will say in my state, in 2024, our Delaware State Treasurer rolled out a program called Delaware Earns, and it's a retirement plan that makes it easier for the 150,000 Delawareans without access to work-based retirement plans, including independent contractors, to save for the future. Ms. Friedman, how common are plans like Delaware Earns, and are they generally successful?
Thank you for that question. Yes. First of all, I want to say that the Pension Rights Center has been on the ground floor of supporting these approaches. So we had a common ground initiative called the Conversation on Coverage in the early 2000s, and one of our recommendations was to do some sort of state administered plan. We were involved early on with Washington, Connecticut, Illinois, and other programs. So there's probably about 20 states that have implemented this kind of plan. Again, they're modest. They're not Senator Sanders' bill, right? They're not offering, defined benefit plans to everybody, right? But they are, they're expanding coverage for private sector workers who now do not have access to an employer-sponsored plan. So my understanding is that there's hundreds of thousands of now individuals who are participating in these plans. Employers are getting more enthusiastic, and there's been about I think it's about $2 billion saved overall. So congratulations on Delaware in setting up the plan, and we'd like to work with you in any way. There are, additional protections we'd like to see in these plans. We'd like to be able to see the law changed at a federal level so that employers can contribute, because certainly, as Senator Sanders pointed out, you really need, and this is part of our principles, you really need employer and employee contributions if you're going to try to get adequacy. Also, we're looking forward to seeing the Savers Credit that was in Secure 2.0 actually implemented.
You're actually answering my next question.
Oh,
which is
good. So because that is a government match for low and moderate wage earners in IRA's 401k plans, and we think that's super important. We'd like to see Congress really working to implement the Savers Match and even make it high, expand it in terms of eligibility and also in terms of the amount.
Can you talk about how the Savers Match would work in practice and why this is such a big deal for both the traditional employees as well as independent workers?
Well, okay, I think that we're still waiting to see how it's going to work. But the idea, I think, would be that if low and moderate wage earners put in money, then the government would match that. So that becomes almost like an employer match. It's super important for low and moderate wage earners. It's something the Pension Rights Center and most consumer retiree and other organizations have worked on for a very, very long time. We were really happy when it was passed as part of Secure 2. We now need to improve it. So I think we have to work on the what I would call the incremental and the large. So, and that's where the Pension Rights Center is. So we're going to be doing a conference in 2026 as part of our 50th anniversary celebration, and we're going to be continuing this dialogue.
Thank you so much. I had the opportunity in my state to serve as the state personnel director, so the pension office was within our purview, and also benefits and dealing with benefits, and particularly healthcare as well is of concern to me, and I hope that we really take seriously the fact that there are so many people in this country that still don't have access to affordable healthcare, and that we continue to try to work together to make it strong. I think when we start chipping away at the Affordable Care Act and chipping away at Medicaid and chipping away, it moves us further away from our goal. Thank you. I yield back.
Thank you, Senator. Senator Kane.
Mr. Chair, on this topic, I do think there are a number of areas where we have been and can be bipartisan. There's some huge differences of opinion. With the chairman, he and I have bills together to focus on auto-enrollment in private pension plans for folks who work with companies that offer them. We have a bill to change the mandatory age for if a company offers a private pension plan. Right now, it has to make that available to every full-time worker over age 21. We want to change it to over age 18. We have Social Security proposals. So there is some bipartisan space, albeit some differences of opinion. Here today, it strikes me that on some big principles, we ought to be able to agree. Devil's in the details. One is a principle that I don't hear disagreement about among the panel, that folks who want to unionize and vote for a union should be able to have a union. And one of the reasons I decided to support the PRO Act is the fact that after a tough unionization campaign, so often workers who successfully vote to unionize, they never see a contract. The employer, having lost the election, just never enters into a contract. And that seems to completely cut against the notion of a workplace democracy where there's an election and then there's a consequence. But if workers vote to unionize, they ought to see a contract, and the PRO Act provides a mechanism for that to happen. Second, workers should not be misclassified as independent contractors if they're employees, and that happens every day in every state, including Virginia. I've seen examples of it. But I'm also sympathetic to the position that folks who really want to be their own boss and be independent contractors should be. And so that balance, not letting people get ripped off and pushed into independent contractor status, allowing people who want to be their own boss to be their own boss, trying to find that balance is really important. 2 of my 3 kids are artists, and they're just the classic, they wouldn't call themselves independent contractors, they would call themselves artists. And the way they make their way in the world is, part-time jobs that don't have any benefits, and then sale of art, often through like an LLC or something they set up to do their artistic work, and then other little gig work here and there. And that's what they want to do. They're not doing that because anybody's, an employer is pushing them to do it. They're doing it because that's what they want to do. And I kind of really admired it. It's kind of a DIY. I want to be my own boss. And wanting to be your own boss, was a good thing. And so trying to find that balance between keeping people from being ripped off and preserving the ability of folks who want to be their own boss to be their own boss. I mean, I think that's what we have to do. The two most important benefits, if you just summarize it, that need to be portable are health and retirement. And I acknowledge what Senator Hassan said. We've just taken a huge step backwards on the health side with the reconciliation bill. The CBO estimate is about 16 million people will lose their health insurance either because of changes to Medicaid or because of the changes to the premium support available under the Affordable Care Act. The ACA creation of exchanges where people could buy insurance individually and get premium support if they were low income has been a huge boon, in Virginia at least, to innovation and entrepreneurship. People who are locked into a job, I really wish I didn't have to work at this job and I'm locked into it because I need health insurance, suddenly had the ability to go and buy health insurance. And if they were starting out a business and they didn't have a lot of income, they could get premium support. And premium support that would enable them to have insurance for their family. That's how my two artist kids get health insurance. They don't have an employer that gives it to them. They get health insurance because they go on the exchange, and with premium support, they're able to afford it. Insurance at the end of the year, because of the expiration of some of the premium support that was put in place in the American Rescue Plan, is going to get dramatically more expensive, and especially for young people. For young working people, they're really going to see their premiums go up. And that's going to lock some people into jobs as employees when they would really want to be their own boss. So I applaud anybody who's going to bat for the artists and for the independent contractors, and I would just hope that you would be every bit as strong in supporting the availability of health insurance and premium support as we need to be, because we're going to see a tsunami of people losing health insurance or seeing their premiums jack up by 50, 70, 80% when we get to year end. And that is cutting against a goal that we all share, that people should have portable benefits. So that is my plea to everybody. And Mr. Chair, the last thing I'll say is this. I really wish this hearing was one where we were all sitting around a table and just like firing questions at each other, because this has been a good one. And a lot of ideas are out. And, I'd like to interrupt somebody and challenge them, and I'd like them to interrupt me and challenge. So this is there is enough common ground conceptually with challenges on how do we find match on the details. That's sort of the traditional 5 minutes and, okay, now on to the next witness doesn't necessarily get out what we need to get out. But I do think a panel like this and a discussion like this is really important. Sometimes on the HELP committee, it's like health, education, labor, pension. We don't really give the P in the HELP committee the attention it deserves, and that's why even after being on the floor till 2:30 last night, I was really glad that you had this hearing this morning. Thanks.
Well, thank you for that. And my sense from that, there's an incredible amount of common ground to help our fellow American. So how do we get there? Senator Also Brooks.
Good morning. Thank you so much, Mr. Chair, and thank you so much as well to all of our witnesses. I agree mostly with what Senator Kaine says, except I do not agree that I'm so happy to have a hearing after we were up until 2:30 last night. I don't know about that concept. Thank you as well to our ranking member for hosting today's hearing. I just want to say at the top that I really do fully support the concept of unlocking benefits and the promise of the American dream for all workers. I also agree with the concept that the way that we work is changing, and that we have to really leave room for that the way that people want to work is changing. The thing I disagree with is what is preventing workers from achieving the dream. So just in the past few months, we've seen this administration take repeated and unprecedented steps to attack the American worker and undermine federal worker protections. We've seen the firing, for example, of tens of thousands of federal workers who are my constituents without cause. We've seen the steamrolling of civil servant protections clearly in statute, and we've also seen the issuing of executive orders that eliminate collective bargaining rights across federal agencies. We've seen the gutting and politicizing of the Merit Systems Protection Board, the NLRB, and the EEOC. And so this administration has targeted collective bargaining agreements, and agencies that afford workers due process. So today, this committee, I believe, is considering legislation that would yet again undermine the American worker. So, Mr. Driscoll, I have a question for you. The Senate just voted on a bill a few weeks ago that would kick millions of Americans off of their health insurance and increase costs for families. And now we're discussing a bill that would, I think, further erode patient protections and increase healthcare costs. So can you just talk about unions again and help to educate the public about the way the unions every day work to fight for real health benefits and lower healthcare costs for their members and their families?
Yeah, thank you for the question, Senator Brooks. Yeah, the reconciliation bill is going to have devastating effects at the state level. As Senator Kane just referred to, the support for state exchanges, which are critical not just for workers, but for independent contractors to access health care, is going to be devastated. And in turn, those uninsured patients, because they will show up somewhere, they may not get their regular checkup, but they'll show up at the emergency room. And there's a bill to pay, and healthcare providers can't be doing that for free. They're going to look to other people with pockets, and that's going to be the insured plans that unions and their employers jointly designed to take care of that. So yeah, we're going to bear the burden of that cost.
And as you've mentioned, just kind of further building on that, the rising uncompensated care cost is something that's going to be really devastating to the whole system. And that, as well as the Republican reconciliation bill, will actually increase costs for working families with employment-based coverage. And can you just talk a bit more about how that costs? Because the whole theme is here that we are increasing costs for working people.
Correct. I note that the large agreement here today is the rising cost of health care and how pressing that is on families. And how we address that, I think we can agree on as a principle we should be getting. What we actually do to arrive at that is going to be the key difference. Expansion of plans that don't provide for employee input, the actual beneficiaries, fiduciary obligations. Union health plans actually have employee input into their design. That doesn't exist with some of these other health plans that are out there. I think we need to be careful in advancing a principle that at the same time should always preserve do no harm to the existing systems, and that's my concern with what this legislation could do.
And finally, with the last few seconds that I have, today's hearing is framed around benefits, but I think it's impossible to separate the conversation from the Trump administration's broader anti-worker agenda. And so I just want to ask you how the attacks on federal workers, because I don't think we can ever forget the way that our federal workers have been demonized. These are patriots. They are my constituents, many of whom have worked for decades under both Republican and Democratic. They don't care who the president is. They just work for the people. But how do those attacks and collective bargaining agreement threaten really all workers?
Yeah, I couldn't agree more. These are public servants who've dedicated their lives to providing vital services. And if collective bargaining can be wiped out at the stroke of a pen or an executive action in the federal sector, I have every reason to believe that the same effort could happen for collective bargaining agreements for workers across this country.
Thank you. Thank you so much, Mr. Chair and Mr. Ranking Member.
Hickenlooper just got in because they couldn't find my end of hearing notes. So, what impeccable timing. Senator Hickenlooper.
Thank you, Mr. Chair. Appreciate your patience, or actually, I accommodate your lack of patience. You almost threw me off. Thank you all for being here. Appreciate all of your public service. This is a chaotic time in the workplace, as you all know, and we've spent a lot of time in our office working to look at how do we provide more secure retirement futures for all workers, all different kinds. So let me start with Ms. Freedom and talk a little bit about we have a bill called the Retirement Savings for Americans Act. I don't know if you've had a chance to look it over, but in Colorado, 80% of our workers work at very small companies. Either they're working as gig workers or companies with less than 50 employees. They're less likely than those working at larger firms to have literally any retirement savings through their workplaces. And when you add those very small businesses, add the gig workers to them, it becomes a significant liability to the future of Colorado, and I would argue to our country. Now, as a former small business owner, and I had started a restaurant that brews its own beer, but we had a number of restaurants. It was really hard for us. We went out, we did put in a 401k program, but the cost for a small business was burdensome, to say the least. The Retirement Savings for Americans Act, I think, provides a real solution. So workers without access to an employer-based retirement plan would be enrolled in a plan similar to TSP that we have access to here in Congress and that most federal employees have access to. More importantly, these plans would be portable, would follow the workers for their entire lives. So, Ms. Friedman, how important is it that we expand access to retirement benefits for all workers?
Thank you so much. First of all, Senator, do you have any of that beer here today? No, I'm only kidding.
We try to keep it always.
I could use one about now. No, I'm only kidding. So, yeah, I mean, it's super important. As we've talked about today, we've talked about the fact that millions and millions of people, 54 million or something, don't even have any kind of retirement savings plan to supplement Social Security. So that's just wrong in the richest country in the world that doesn't exist. So I want to say that, yeah, we commend you for introducing your bill. We are evaluating lots of bills right now based on our principles, some of which I put in my written statement. Right. And we're looking forward to talking to you. We do support the state auto IRA bills, and we're very much in support of the aspirations of Senator Sanders' bill. And so, yeah, thank you. Thank you for introducing.
Appreciate that. And let me just put a finer point on it. We've got 800,000 employees in Colorado that generally have nothing. They have nothing at present and really nothing in the works that will make sure that they have a happy, safe retirement. And I think we need a number of more innovative retirement savings options so that this workforce, largely low-income workers, can have that opportunity. So if you're going to look at a bill like the Retirement Savings for Americans Act, which is auto-enrolled, people would automatically become enrolled, the federal government would pay the first 1% and then match their savings as they are able to save more. So how would a bill like Retirement Savings for Americans Act improve access to retirement savings for low and middle class employees, middle income workers, I guess I'd say? And within that, it's portable, that it will follow them for their entire working careers.
Yeah, I mean, so again, we have to do more study on it, but it sounds like you're making a definite progress. And again, as I said in our statement, we're evaluating a number of proposals. There's the Pensions for All proposal and your proposal and many others, and we look forward to working with you.
And just I'm out of time, so I have written questions. You'll all get your chance. I do want to emphasize that we spend about $276 billion a year in federal subsidies for retirements to encourage people to retire. And now when you look at, when I started out in my IRA, my 401k, you were allowed to put $2,000 away and get that tax deductible to grow. Now it's close to $30,000. And of that $276 billion a year that the federal government puts into subsidies for people's retirement, 16 billion out of 276 billion goes to the lowest 40% of workers. And so my argument is I think we could lower that from almost $30,000 a year for people, for wealthy individuals, high income earners, move that down to maybe $25,000, still very generous, but that would create the cushion that would allow us to put something like what I'm suggesting, that 1% going to every worker auto-enrolled that would be portable for their lives. Anyway, I yield back before the hammer cuts me off. I could see it coming.
No, but actually, I very much enjoyed your last comment, so thank you. Members will have 10 business days for questions for the record. That's July 31st, 5 p.m. I thank my witnesses for being here. Again, I think it really was illuminating. So thank you. And with that, the committee is adjourned.